So right now I want to talk to you about taking over-the-counter medications or even going to your medical doctor for medications to help you with pain. My preference is that you take no drugs, right? They all have side effects. People experience negative results from taking drugs all the time. However, I do understand that sometimes it is necessary for you to get through your day, to deal with the pain, and to be able to function. And so in these instances, I want to talk about some of the most common things that people take and then maybe some of the things that you should ask your doctor about if you decide you need to take that next step. So first thing is some of the over-the-counter stuff. Ibuprofen in most cases is going to be better when you're having a flare-up or you've just started feeling a lot of pain. In particular, if you can take the back of your hand and you feel the spot that has pain and it feels hot or warm, that tells you that you have inflammation. That means adding heat to it is not the answer, and taking away heat through a medication can be very helpful. Ibuprofen seems to be the best when it comes to this. The next most common thing that people take is Tylenol. Now, Tylenol taken too much can really cause a lot of problems. So again, this is only a temporary pain relief measure. Tylenol is really best for fever or for headaches. If you're having back pain, I don't care if it says Tylenol for back pain, it's probably not going to help. It's not nearly as effective as taking the ibuprofen. However, if you are dealing with headaches, Tylenol is a much better solution than is ibuprofen. They have different mechanisms in how they work, and most patients report higher success rate with Tylenol when it comes to their headaches and ibuprofen when it comes to inflammation. The next most common is Aleve or naproxen. This is really for a chronic problem. So let's say you've got an old football knee injury that you know is going to hurt and ache all day long no matter what you do. And you just want to take something on those days where it's particularly bad. That's where Aleve would come in. We found that the patients who are taking Aleve for a new flare-up of a problem find that it's not quite as fast acting as they would like, and they're not experiencing as much benefit as they do when they take some of the other medications. So Aleve is for a chronic problem. That's where we see the greater amount of benefit. Now, I know all of their TV commercials make it seem like any one of these are just as good as the other, but that's not our experience. That's not what we've seen for patients. So again, it's ibuprofen for brand new stuff and back pain, Tylenol for headaches, and Aleve if it's more of a chronic problem. However, if you're going to your medical doctor and you find these are just not strong enough and you need a stronger dose of something, one of the things that we've noticed is that visiting a medical doctor means very often you're going to receive painkillers and muscle relaxers. The negative aspect to a painkiller is it's not taking away inflammation, it's only blocking pain, which is good, right? You want the pain to go away. However, it's not really giving you any feedback that anything that you're doing is helping or hurting it, which means a lot of times people will make things worse because they go right back to resuming all the things that caused that problem in the first place. So muscle relaxers are also one of those things that they relax all the muscles in your body, whereas an anti-inflammatory is going to take away heat and also help the muscle relax. The muscle relaxer is simply relaxing the muscles. A lot of our patients find that they cannot function during their day while taking muscle relaxers, so they save the muscle relaxers for nighttime when they're trying to get some sleep. My preference would be, and this is up to you and your medical doctor, that you take an anti-inflammatory. Now that may be in the result of, in the form of a steroid pack or some sort of stronger version of ibuprofen, but the anti-inflammatory route is going to be much more helpful to decreasing some of the swelling that might be going on in the spine and taking away some of that heat. But it's going to be much better than the painkillers or muscle relaxers, but just some reason the doctors like to give those out instead. Hopefully you don't have to take any drugs and you can simply use ice, which is the much safer over-the-counter way of dealing with pain and inflammation. But if you find you need something extra, these tips should help you figure out which thing is the right thing for you to do.